Have you ever noticed how some difficult experiences from the past just seem to stick with you, lingering long after they happened? It is like they are always there, affecting your thoughts and feelings. Understanding when these persistent feelings might signify something more specific is really important for getting the right kind of support. For a post-traumatic stress disorder, or PTSD, diagnosis, symptoms need to be present for more than 1 month. This 1-month timeframe is a crucial marker that helps mental health professionals understand the nature and persistence of your experiences following a traumatic event. The reason this 1-month duration is so important is because it helps differentiate post-traumatic stress disorder from an acute stress response. It is completely normal for anyone to feel stress, anxiety, or have difficulty sleeping after experiencing a traumatic event. These initial reactions are part of the body's natural way of coping with distress. However, for a diagnosis of PTSD, these symptoms must persist and cause significant distress or impairment in important areas of functioning, like your work, relationships, or daily life, for a period exceeding 30 days. This criterion, along with others, is outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, also known as DSM-5-TR, which is the standard guide for diagnosing mental health conditions. It is the persistence and severity over this specific time that moves a normal stress reaction into the realm of a PTSD diagnosis. So, what does this mean for you? If you or someone you care about has been experiencing symptoms such as flashbacks, nightmares, avoidance of certain places or activities, negative changes in mood, or heightened reactivity for longer than a month following a traumatic event, it is a really good idea to reach out to a mental health professional. This knowledge empowers you to understand when your persistent symptoms might warrant professional attention and helps you advocate for yourself. Keeping a journal of your symptoms and how long they have been occurring can be a very helpful step before your appointment. It is also interesting to note that there is a related diagnosis called acute stress disorder, or a SD. This applies when symptoms similar to PTSD are experienced, but they last for a shorter period, specifically from 3 days to 1 month after the traumatic event. This highlights that recognizing and addressing trauma-related symptoms early on, regardless of whether they meet the full PTSD timeframe, is incredibly beneficial. Early intervention can make a significant difference in recovery. Understanding the required timeframe for post-traumatic stress disorder symptoms is more than just a clinical detail. It is a vital piece of information that guides when and how to seek appropriate support. Knowing that symptoms need to persist for over a month for a PTSD diagnosis helps you or a loved one recognize when a normal stress reaction might have evolved into a condition that benefits greatly from professional care, setting you on a clearer path toward healing and well-being.